The opioid crisis is far from overblown, but it's multifaceted. I think Oklahoma is in a crisis they don't realize they're in. They seem to think that the opioid addiction is still something that's out in other places. It's not, it's here. That's a serious issue for us, and we should treat it as a serious issue.
When you think about a public health crisis, let's look back and think about seatbelts. 25 years ago, when maybe not everyone wore their seatbelt. And then we realized we can save lives by people simply wearing their seatbelt. And we talked about it. There were campaigns. Parents made sure their children were buckling up. Children make sure their parents are buckling up. It's part of a national conversation. It happens in every family and every household. We can address this issue just like any other public health epidemic, but we have to start with education and discussion.
What we need to do about this epidemic is very similar to what you would do for any disease epidemic. If you think about what you would need to do to bring an Ebola outbreak under control, the first thing you would do if there was an outbreak of a disease in your community would be to contain it. You want to prevent more people from getting the disease. And the second thing that you do is you make sure that the people who have the disease are getting effective treatment for it so that the disease doesn't kill them. And that's basically what we have to do for our opioid addiction epidemic. We have to prevent more Americans from becoming addicted to opioids. And we have to see that the people who are addicted have access to effective treatment so their addiction doesn't kill them. Now, when we talk about preventing opioid addiction, more than anything else, that boils down to much more cautious prescribing so that doctors don't directly addict their patients and so that we don't indirectly cause addiction by stocking everybody's home with a highly addictive drug.
We always have to think twice before we take an opioid or fill an opioid prescription. Think about whether or not you really want your child to ever take an opioid. If they have a dental procedure or an injury, is there any other way this problem could be handled? Opioids must be the last and final resort, not our first line of defense.
If your doctor prescribes you an opioid, just ask about it and say, is there another alternative? Can I start with something less? So if you're in a point that you have an option to use something besides an opioid for that, use it. Start with the lowest possible that you can rather than the highest possible that you can.
It also starts with the limiting of the supply, and that's got to come from the doctors. We can't give grandma 6 months worth of prescription to keep in her medicine cabinet for her grandson who's going through a rough time to get a hold of.
And if you do need them, safeguard them. You don't have to buy fancy biometric boxes. Just simply don't put them in the places where a drug addict is going to want to look. And those are the medicine cabinets, the nightstand drawers, the typical places. Simply putting it out of sight in some place that only you know about. Keeping it with you, keeping it in your purse, taking it with you to work. Don't leave it in the house for your teenagers and their friends when they get out of school at 3 o'clock to go sneak in there looking for pills. And then certainly if you no longer need it, get rid of it. You get 30 hydrocodone for a sore knee and you only use 20. We're all guilty of keeping old medicine in the house, and it could just be one of those pills that ends up killing one of your teenager's friends who took it thinking it was going to be safe, or it could be a neighbor, somebody else. And we don't want anybody to live with the guilt of somebody they love dying from something that they should have thrown away 3 years ago.
We can prevent more people from becoming addicted, but the genie's out of the bottle. Millions are addicted. So you have to see that people who become opioid addicted can access effective treatment.
So the good news is there is hope. Just like the disease of diabetes or asthma, addiction can be treated. People successfully conquer these diseases and live a life in recovery.
If someone does get addicted, we have a lot of options for them. And the most important of which is this concept called medication-assisted treatment, where we provide them with a similar substance called buprenorphine, which works on those receptors, but it does it in a very different way, and allows people with addiction to go to work and to function and to manage their addiction without all the destruction. They're not going to commit crimes. They're not going to spend their paycheck trying to get heroin. They're actually able to live close to normal lives.
Literally, the same way the disease developed in the brain and chemical reactions began to take place in the brain that caused addiction, By engaging in treatment and stopping use, our brain chemistry begins to return to healthy or normal brain chemistry. People can and do recover. It happens in the brain the same way the disease happens in the brain.
There's nobody beyond treatment. There's nobody that I would give up hope for. There are some people whose disease is very, very progressed and they're very, very sick and they need a lot of resources.
Our drug courts are some of the best in the United States. We have amazing teams headed by a judge who ensures that people are held accountable, that they're engaged in treatment, that they're going to work or in school or job training to get a job, and we have some of the best outcomes in the United States. But our drug courts are full almost every day. We haven't seen an increase in drug court funding in over a decade, and there are people who are sent to prison every single day because there's no more room in their local drug court.
Diversionary programs have got to be available, they've got to be available, and they've got to be well managed, and they've got to be focused on what the best science is with regard to recovery.
I think every Oklahoman needs to get loud about addiction. Every Oklahoman needs to use their voice at the polls. Every Oklahoman needs to use their voice to call their legislators. And every Oklahoman needs to just get loud.
With all the stigma going on in opioid abuse, individuals don't know when to get treatment, they don't know how to get treatment, and because of all the stigma within the political system and whatnot, there's not a lot of treatment for them to get.
Currently in the state of Oklahoma, we only have enough resources to serve 1 out of every 3 people who needs help. It unfortunately has high rates of an uninsured population. For many people, the only chance they have at treatment and possibly to save their lives is making sure that there are services funded in whole or in part by the state available in their local community. And for the last several years, we've seen that restricted in Oklahoma. What that means is that we have waiting lists every single day of persons who are brave enough to ask for help, that want to fight their disease, who want a chance at life, they want to take care of their family, they don't want to lose their job, or they want to regain employment. And we tell them, currently you can be number 420 on our waiting list. We'll call you when there's a treatment bed available. Often by the time we make that call, they're either no longer ready for treatment or they've seen a dire consequence while waiting.
There's no simple one solution that solves an opioid crisis, but we absolutely have to be able to start in multiple areas and take it on as many places as we can. So this is a hand-in-hand kind of thing across the country, to be able to hold hands. The federal government has a role, they better do it, and they better do it well. But families and local governments also have a major role, and if they don't do it, we will never be able to stop this.
To people who are watching this who may feel like this problem is overwhelming, we actually all have a role to play.
We need to talk about addiction. We need to not be embarrassed or ashamed. We need to say it happens in most families. People still want to say, not on my watch, or it couldn't happen to me. It can happen to anyone.
I know that there's hope. I'm living proof that there's hope.
This addiction is preventable, and it's certainly treatable. We have the power and we have the ability to effect a positive change and turn the direction of this whole thing. And we can do it.